Merci à tous. Je suis Gilbert Agbodamakou et je suis
Hello, everyone.
développeur
Thank you very much.
d'applications à
My
Muso.
name is Gilbert
Et
Agbodamakou,
aujourd'hui, je
and
suis
I
là
am
avec mon
one of the
collègue
developers of
Sori
this
Brema
application. So
pour vous
today I'm
présenter
here
en
with
fait
my
la gestion
colleague
des
Sori
intrants
Brema,
à partir
and
du
we will be
module
talking
réutilisable
together about the
Stock
inventory management
Monitoring
from this
Workflow.
SMW module, which is a reusable model.
Slide suivant.
Next slide, please.
Alors, d'abord, c'est quoi le projet Muso?
First of all, what
Le
is
projet
our
Muso
project, the
sert à
Muso
la
project?
collecte des
Muso
données,
project is,
collecte
first of
communautaire des
all, a
données pour
project that
soutenir
collects
les
the
activités de
community
l'ONG Muso.
data so
Il y a
that
une
to
ONG
support the
qui vise à
activities
mettre
of
fin
different NGOs, and first of all of the NGO
à la crise
Muso.
de
And
mortalité
the
infantile et
Muso NGO
maternelle et
aims
assurer une
to
couverture
end the
sanitaire universelle
infant
à
and
grande
maternal
échelle.
mortality
Donc, nous
crisis and
sommes
ensure
disponibles en fait
universal
dans
health
deux
coverage
pays,
on a larger
euh,
scale. So
le
we are
Mali
basically
et la Côte
available
d'Ivoire.
in two countries,
Et dans
in
l'ensemble des
Mali
deux
and
pays, nous
also in
avons
Côte
621
d'Ivoire.
utilisateurs
And in
actifs,
these two countries, we have
dont
621
463
active users
utilisateurs
as
actifs au
of
Mali et
today.
158
463 of
utilisateurs en
these
Côte
users
d'Ivoire.
are in Mali, and the rest,
Slide suivant.
158, are in Côte d'Ivoire. Next slide, please.
Alors, cette présentation se subdivise
So
en
this
5 parties.
presentation, I have
D'abord,
basically
nous allons voir la
divided it
configuration
into 5
hiérarchique à
different
5
parts. So
niveaux
first of
à
all, I
Muso.
will talk about
Et nous
our
premiers pas
5-level
avec
hierarchy
le
configuration,
module Stock
and
Monitoring Workflow, les
the
limitations que nous
very
avons
important
rencontrées
part for
et
us,
les
which is
adaptations que nous avons
how to
faites au
monitor the
workflow pour plus
SMW
d'efficacité.
flow,
Et
and
enfin,
all the
nous aurons
limitations
une
that we
critique brève
have
du produit
encountered, as
final.
well as how we can adopt the workflow for the efficiency. And we will also do a small
Suivant.
demo at the end. Next slide, please.
Alors, maintenant, nous allons parler de la configuration
So
hiérarchique
the
à
first
5
part
niveaux.
is the 5-level
Suivant.
hierarchy configuration. Next one.
Donc, dans nos deux pays d'implémentation,
So in two countries
nous
that we
avons
are
dans chaque pays
rolling
2
out
sites. Et dans
this
les sites
module,
se
we have 2
trouvent
sites
les
per
aires de
country.
santé. Et dans
And
les aires de
in
santé,
the
nous
site,
avons
we
des zones de
have
supervision.
all
Et
the
dans les zones de
different
supervision, les
areas of
zones d'ASC.
supervision that we
Et dans les
have
zones
there.
d'ASC, nous
So
avons les
the
ménages. Et concernant
CHW
le projet
areas,
de
and
gestion des intrants,
we
nous
see
avons
the
3
scheme right here. So the site, the
types
health areas, the
d'utilisateurs
supervision areas,
spécifiques.
the CHW
Donc, au
areas, and
niveau
the
des aires de
households. And we
santé,
have
nous avons
3
les
specific
gestionnaires de
types
stock.
of
Et
users.
au niveau des zones de
So at
supervision,
the
les
level of the
superviseurs
health area, we have
d'ASC.
the stock
Et
manager.
au niveau des
Then for
zones
the
d'ASC, nous
supervision
avons
area,
les
we
ASC.
have the CHW
Donc, les
supervisor.
3
And
premiers
for the
types
CHW
d'utilisateurs
area, we have the
les 2
CHW. So
premiers
these are
types
the 3
d'utilisateurs sont
most
ceux-là même qui
important
font
and
la
first
gestion
types of the users. So
d'intrants
these are those
vis-à-vis
that
de
will
leur
be
niveau
managing
inférieur
all
direct.
the stocks
Donc,
and
les
all the
gestionnaires
inputs at the level
de
of
stock
at the
fait
direct
de la
level.
distribution
So
des stocks
the
vis-à-vis des
distribution of
superviseurs
the stock
d'ASC et aussi ajuste ces stocks.
with respect
Et le
to the
superviseur fait de même
supervisor,
pour
and the
l'ASC.
supervisor will be also adjusting all of this, and
Par
the
contre,
supervisor will
l'ASC
be doing
fait
exactly the
uniquement que
same
de la
thing
dispensation
down
des
to
stocks vis-à-vis des
CHW.
patients.
But for the CHW, it will be
Slide
only
suivant.
dispensing of the stocks. So you can see this role explained right here. Next slide, please.
Alors, notre premier pas avec le
Now,
module Stock
how did we
Monitoring
get
Workflow.
started with this SMW module, stock monitoring workflow? Please, next slide.
Voilà. En 2023, nous nous
Here we go.
étions
So in
assignés pour tâche
2023,
d'intégrer un
we
module de gestion d'intrants dans
started
notre
to
configuration.
integrate a module of
Et comme vous le
management that will
savez,
be part of our configuration.
CHT
And
est un
just
ensemble
as you
d'outils pour
probably
la
know
collecte
it,
des données.
CHT
Donc, nous ne
is
savions
a
pas réellement comment
whole of
faire de la
different
gestion
tools
d'intrants avec ce
for
module.
collecting data. So we didn't
Nous
really
avons
know
discuté
how
avec
to
Medic
manage the
longtemps
inputs
et
with
ils
all
nous
of
ont fait
these
savoir
modules, which
qu'ils
is why
avaient
we
un
have been
outil
talking with
qui était en
Medic
conception.
for a lot of time.
Donc, nous
And we
avons saisi
actually knew
l'opportunité et ça
that
nous
they
a
had this
inspiré
tool that they were working
à
on. So
faire
we
le
actually
premier
used this
pas de
opportunity
gestion
as a
d'intrants
point
avec
of
le CHT.
inspiration. So this is something
Donc,
that
après
basically
avoir
pushed us
configuré
to
et
start
initialisé
managing
l'outil dans
the
son
stocks.
utilisation,
And
nous
first
avons
of all,
vu
we
que
made the
venir avec
configuration and we
un workflow
started
initial
using this
complet
tool.
avec
And we
des
actually
rôles
had this
dans les différents
complete
niveaux
initial workflow. So we
hiérarchiques.
started testing with
Ça
this,
nous a
and we
permis
also
de
looked at different
concevoir
roles at the
très
different
rapidement des
hierarchical
formulaires
levels. It
et
actually
ça
allowed us
réduit
to very quickly
considérablement
create
la
a lot of
complexité
forms,
et
and it reduced a
les
lot the
différents formulaires.
complexity
Parce que
for
quand
a
vous
large
travaillez
number
avec
of different forms.
plusieurs
Because
intrants,
whenever you are
la
working
réalisation des
with
formulaires,
many
ça va
different
être très long
inputs,
et très
the
fatigant.
creation of forms
Et
is a very
aussi,
lengthy
avec les
process.
différents niveaux
At the same
hiérarchiques,
time,
il y
with
a
all the different
les
hierarchical
règles de
levels,
réplication
we have the rules for the replication that make even more difficult the transition of the document from one hierarchical level to another. So with the use of this tool SMW, we actually were able to use the needs sign-off for communication with supervisors so that to somehow counter all these replication rules. Next slide, please. I guess I will be continuing from here, no?
Oui. Donc, après,
yes, indeed. So, once we had this initial workflow, we have seen in our tests that it allowed us to look at the stocks and to see the stocks in a very easy, user-friendly way. And we were able to do it with forms or not. We weren't really sure about this, but we actually were thinking about how can we make sure that it's visible in a very clear way for the end user. And we actually had a very precise tracking of dispensed inputs. And what is really interesting here with respect to the data management is that we actually had this very clear separation, very clear distinction between collection data and dispensations via this technology that is also part of the CHT, the technology that is called additional docs. Next slide, please.
Alors, les limitations rencontrées.
Now, I would like to talk to you about the limitations that we have encountered. We have actually encountered several different limitations in the rollout, in the deployment of our workflow. Next slide, please.
Alors, the
first limitation, the first challenge that we have found, it was the impossibility to update the forms that were generated through this module. Because how does it work? Well, you are defining your settings from the very beginning. You are also defining your inputs. And at the end, you have this form that you can also customize. But once you have customized this form, you can no longer regenerate this form through the tool, which is also quite understandable. And the workflow that is a result of this module has this upflow with a lot of excessive synchronization, meaning that in our hierarchy, the CHT is basically doing all of this, sending all of these requests to the supervisor, and then the supervisor replies. And then this is what generates this incoherence. So in other organizations, it was not a very interesting way of proceeding for us. So the third limitation was the challenge that we had is for the version 3.x of CHT, and this is the limitation to 50 documents at the level of the context summary. How does it appear practically? Well, when you look at this context summary, it actually is calculated with respect to all of this document, and if you see this stock-related document that is below this 50 documents, so this is the stock that is presented to the CHW, well, then this file just disappears, and that's a real problem. And there is also this restricted access to the stock information during the data collection, and this is at the level of the patients as well. So whenever you're looking at this form and you have a new patient in front of you, it is impossible sometimes for you to look at the stock information, and this is really, really bad, because we actually need to know whether we have, let's say, enough paracetamol in the stock so that to treat this patient efficiently. And at the same time, we, when we are talking about the implementation, we have this additional dogs that at the end can generate 2 or 3 different documents. So this increases actually the size. So if you have a more important workflow, the data size is also very important for you. So that's a significant impact as well. Next slide, please. So for us, we actually had to adapt our workflow so that to make sure that it will be more user-friendly and efficient. Next slide, please. So what was adopted? First of all, we actually changed the things. So we basically revised the workflow so that to adopt it a little bit more and to have much more a top-down flow so that to minimize the operational errors that might appear here. So finally, this will be the users that will be given this inputs and then they will be acting on their stocks through the adjustments. And this is something that actually allowed us to reduce the number of synchronizations and also limit the exchanges between two different users. We also have created this daily stock review so that to somehow counter this limitation of 50 documents for the CHT. And here it was very important for us because we had to find a way to inject the file related to stock in these 50 first documents that would appear here so that the CHW will be always seeing this document related to the stock. So basically right now we are working with this version 4, so this problem is no longer relevant for us. We also have eliminated the inventory review because it was a little bit dangerous for us. We did not want to give the possibility to the user to somehow influence this quantity. We wanted for the quantity to be always calculated, and this was like a safety measure for us. So all of this is basically related to the technical side of things, but we also have some additional operational measures that we have implemented in the field so that to optimize the use of the inputs. Next slide, please. So I think that this is it for the presentation, and now I would like to give the floor to my colleague, Sobri Brahima, and he will be doing the demo. So this is just one of the demos of this tool. Thank you. If you are speaking, we cannot hear you.
Oui, Gilbert, alors, maintenant.
Oh, yes, sorry.
Oui, on vous entend maintenant.
Yeah, now we can hear you.
On vous entend plus.
We can no longer hear you.
On vous entend plus.
Hello.
Allô, chef Sori, vous m'entendez?
Hello. Dear Sori, can you hear me? Because we cannot hear you.
Bon, je crois que je vais partager mon écran.
Oh, I believe that I will be sharing my screen so that to make this demo, because unfortunately we do not have too much time.
Donc, vous voyez mon écran?
So right now, I believe that you can see my screen.
Oui. Oui, j'ai vu.
Yes.
Merci, Gilbert.
Yes,
Okay.
indeed.
Là, je suis connecté
Thank you,
avec un
fantastic.
compte de gestionnaire.
So now I
Et je
am
vais faire
connected
une
and I have
distribution
this
des vers cette
supervisor
zone-là ici.
account, and I will be doing this distribution of the inputs to this area of supervision.
Donc, comment
Hopefully
est-ce que
this
nous
is
faisons la distribution
already
des
set up. Yes, it is. So how do we do this distribution of the inputs? So we have the supervisor, who is a manager here. That's his role. So we are going to the supervision area right here, and then there's action menu that is right here. And we have the management of the stock management that is right here, the input management that is right here. So we click on it and then we specify the operation. So either this will be distribution or adjustment. Well, here I select distribution. Then it asks me when the operation has been done. I say today, yes. So I click on next, and here I have to basically select the inputs. So whatever is the group of the stock of the inputs that I have to use in here. So I just select malaria, for example, here, and here I select CTA 20 on 120 milligrams and against the malaria TDR. The quantity is right here. Oh, so you're here, sorry? Sorry, Brandia, no problem. I will just continue. Unfortunately, sorry, my connection is very bad. Sorry, Brandia is saying. If there are any questions, I will be here and I will be glad to answer. Great. So the quantity, I select 100. And I select the quantity for the TDR as well, 100 units as well. So here, this is the summary of the operation once I click on follow, and then I click on submit. So right here, after the submission, I can see all those inputs that will be sent directly to the supervisor of the CHW. So then I will disconnect and I will connect as a supervisor.
Voilà, ça tourne.
So the connection is being made. And here I am. Now I'm in the account of this supervisor who received the information. So once I'm connected as a supervisor, right here, I will see that there is this task, distribution task for the inputs. So when I click on it, I can see these two that were sent to me right here. So we can see that this was for malaria, the inputs that are right here, the quantity that is here. So I click on follow. And it actually asks me, what should I do with this? Confirm or no? So I say yes, confirm. And if I say yes, it will be asking me when was it done, whether it was today or no, or a different operation. So I say yes. So if I say that I do not want to confirm it, it actually asks me why. Why shouldn't I confirm this specific reception? So I would probably say I have the sufficient quantity of this input, or I have another reason that I can specify right here in the specific field. So right here, I will say yes and yes. So it was for today and I confirm it. Then I click next. Here I have accepted it and I'm going to the contact summary right here. So at the contact summary, you can see all the inputs, everything that I have in my stock. So you can see here at the level of these two that I have selected, where are they? CTA20 on 120 milligrams and TDR against malaria, that is right here. So you can see 100 tablets here and 100 tablets right here that appear here. So as a supervisor, I have enough here. So the colors are also significant here. I actually forgot to mention this, but the colors also have their role to play. We don't really have a lot of time so that to explain all the details, but each color has also a specific meaning. So here I can also decide to do a distribution of the inputs for the CHW. So I can go right here on this specific CHW and I can do this distribution and now we'll adjust his stock. So right here, well, let's say I have 50 units of TDR, so I will give them, oh, sorry, I have 100 units of TDR and I would like to give them 50. So I'm doing the same thing. It's the same operation just as before. So I select malaria, I select what are the units of the stock that I would like to give them and the quantity as well. So 50 and 50 both times. And then I click on next. Here we go. So when I have been talking about these limitations that we have created, see, here I only can input between 1 and 35 units for TDR. So this one, when I have put 50, it was more than 35. So it actually shows me that it's impossible. So here I adjust the quantity and I make it 20. And I submit it right here. And now I'm going back to my contacts so that to see the quantity. And we can see that right here I have 50 and here I have 80. So this is what I have in my stock. So I can go, well, now I will disconnect and I will go to the account of my CHW to see what happens on their account.
Voilà. Donc c'est chargé.
So here we go. Their account is coming.
Ça tourne toujours.
Just a second. It's connecting right now.
Oh.
Oops, sorry. It takes a little bit of time.
Okay. Donc, c'est venu.
Sorry about that. Here we go. So now we have a distribution of inputs that appears here in the tasks. So first of all, I go to the contacts so that to see what is actually my stock. What is the state of things in there? So, sorry, the page is loading.
Voilà. Vous voyez, actuellement, je n'ai même pas
Here we go.
Ça veut dire
So
qu'on n'a
you
même pas
can
encore
see
initialisé,
right here,
le
I
module de
don't
gestion
even
des
have the
fonds pour
inputs
cette zone
yet,
d'ASC.
meaning that we
Donc,
haven't
je vais au niveau de
initialized the
la fiche de
module
stock
for the inputs
et,
for this
pardon,
specific
des tâches
area
pour
for the
réceptionner en fait
CHW.
la,
So I'm
la
going here
distribution
on
qui a
the
été faite.
tasks.
Donc là,
I'm going on the
je
tasks so
réceptionne,
that to receive the
je lis,
distribution that I was allocated. So here I click on it, I say,
Ici, je
yes,
viens
I
ici.
confirm. I say,
Maintenant,
yes,
j'ai
this is
une
of
fiche de
today.
stock.
And now
Et
I
vous
go
allez
back to
voir
my
que j'ai bien
contacts, and
reçu les
here
50
in the stock, you
unités
can
de
see that I have
CTA et 20
received this 50
unités
units of
de
CTA
TDR.
20, 120 milligrams,
Maintenant, je vais
and the
retourner
TDR,
chez
I have
le
20
superviseur
units
pour
here.
faire
So now I will disconnect
un
once
ajustement.
again, and I will go
Vous
back
voyez
to
comment
the
est-ce que
account
ça
of the
se fait.
supervisor, because the supervisor will need to do an adjustment. So that just to show you how this works.
Voilà. Là, je suis connecté en
Here we
tant que
go. So
superviseur.
I'm connected as a
Et j'ai ma zone
supervisor
d'ASC. Je
once
souhaite
again,
ici faire
and
un
I
ajustement.
need my
Donc,
CHW
je
because
choisis
I need
toujours
to
la zone
adjust
d'ASC.
something for
Je
this
clique sur le menu
CHW1.
d'action
So
et je
I'm
choisis toujours gestion des intrants.
clicking on the menu for the
Je
action,
viens,
and
je dis
once
je vais
again I
faire
click
un
on
ajustement.
managing
Je
the
demande quand est-ce que
stocks.
ça a été fait. Je
And
dis
I
aujourd'hui.
say that I would like to adjust. It asks
je
me
demande quel
when
type
should it be done
d'ajustement je
today.
souhaite
Okay,
faire.
next. Now,
Moi, je
what is the
souhaite prendre
type of the
les
adjustment that I
intrants
would like
auprès
to
de l'ASC.
do?
Donc, ce
So
serait
I
un
actually would
ajustement
like to take some inputs,
négatif.
take some stock
Le
from
positif,
this
c'est lui ajouter
CHW. So it will be a
les
negative
intrants et
adjustment. Positive
mutuel,
is when
c'est dans les deux
I'm
sens.
adding,
Donc,
and
il me
negative
demande
is when
si c'est
I'm
un
taking.
ajustement
And mutual,
négatif.
it's when it goes both
Quel
ways.
est le
So it
motif de
actually
cet
gives me the
ajustement?
three
Je
possibilities,
dis que
positive, negative, or mutual. And then it asks me, what is the
je vais prendre
reason for
lequel,
this
que l'ASC
adjustment?
a perdu,
Well, I'm
il a
saying
perdu
that, let's
des
say
intrants.
my CHW has
Il
lost
me
some of
demande
the stock
quel
units.
intrant.
And it actually
Donc, la
asks me, so
catégorie
what
déjà.
was the
Donc, je vais
category of this
dire, on va
stock?
lui dire, et
Well,
toujours,
I have said that
je vais
this
prendre
was
uniquement que le
Malaria.
CDA.
And once
Je dis
again,
que là, il a perdu
well,
2 unités
I
de
have to
CDA.
mention what was the
Je fais
stock unit
suivant.
that they have lost. I say that this
Et
were
je
2
soumets.
units and this was CTA 2120. And once
Donc,
again, I
la
submit it.
tâche va chez l'ASC.
And
Donc, on va
here
se
we go.
connecter
So the
en tant que
task will
ASC.
basically be sent to this CHW. So I will connect as a CHW so that to show you what happens for them.
Là, je synchronise parce que
Just a second, I need to
Donc, la tâche est
synchronize it,
arrivée
otherwise
ici.
it won't come.
Ajustement
So
d'intrants.
here we see the
Et je
task
vois,
for this
donc,
community
c'est,
health worker. So
le
I
motif
click on it
de
and I see
l'ajustement, c'est un
that
intrant
the
perdu avec l'ASC.
reason for this adjustment
Quantité
is
2.
that the stock
Et je
were
dis, oui,
was
j'accepte.
lost. So this is the adjustment of the quantity, and I have to accept it
Et
or
en ce
reject. So
moment-là,
I accept it, I
je
confirm, I
vois
say that this
ici
was put today, I click on
que,
next.
effectivement, le
And
CTA
here, when I
est
go to
devenu
my
maintenant
contacts
48
and I
au lieu de
look at my
50.
stock, I actually see
Donc,
that
s'il avait
instead of
refusé,
50 for the CTA, I
vous
have
verrez que
48.
ici, ce
So
serait
if
toujours
it
50
was
et le
refused,
superviseur aura
you
une
would
tâche.
have seen
Et quand il
that
va
here
accepter la
it would have
quantité,
been 50, and
son stock ne
then
sera
the
pas mis à jour. Parce
quantity,
que les deux qui viennent
the
d'ici
quantity
sont allés
when
chez
it
le
will be
superviseur.
accepted, it will
On va
not
retourner chez le
update the storage
superviseur et
because
ouvrir.
all this information has to be circulating between the community health worker and the supervisor. So now I'm going back to the supervisor
Voilà.
account.
Donc, ça, c'était la lettre de
Here we go,
distribution
and
des
here's
intrants.
this was the distribution
Voilà,
of
la
the
lettre
inputs, the
ajustement.
distribution
Voilà.
of the stock.
Donc,
So here we see
voici
that
l'intrant.
there is this alert
Voici
for the
la
distribution. So
lettre liée à
here we can
l'ajustement.
see
Mais d'abord, on va
this
aller
is
vérifier
what is related to the
le
adjustment. But
stock
first of
d'intrants.
all, we
Vous
have
voyez que
to
c'est toujours
verify the
à
stock.
50
So you can see
et
that
80
here it's
ici.
still 50 units for the CTA,
Alors
despite the
que
fact that we said that
l'intrant
2 of
a
them
été
were
retiré du
lost.
stock de l'ASC. Donc, normalement, ça doit
And
venir
we
chez le
actually
superviseur.
took
Donc,
it
si je vais
off the
ici,
stock of the CHW, so it
à
actually has to go
l'ajustement
to the
que
stock
je
of the
soumets.
supervisor. So
Donc,
here I
et
go
je
to
verrai
this
maintenant mon stock
adjustment,
qui est mis à jour.
and I
Ah
submit
non,
it,
c'est
and I
perdu,
see
pardon.
that
Ça,
right here.
le motif,
Oh,
c'est le fait
sorry,
ça ne
it
peut
did
pas
not
venir
work.
chez le superviseur. Donc, c'est
I'm sorry,
perdu.
it cannot. I
Ce stock-là
said
n'est
that
pas retrouvé.
it
Si
has
c'était
to
un
go
retrait
back to the
auprès de
supervisor,
l'ASC,
but it actually cannot
auprès
go
de
back to the
l'ASC pour
supervisor
le
because it
superviseur, en
was
ce moment-là,
lost.
ce stock
So
allait
yeah, for the
changer.
supervisor, in this example, nothing
Voilà.
changes. So
Donc,
it's absolutely correct. It
globalement,
stays at 50 and not
c'est un
at
peu cela.
48
Il y a aussi la
because
partie
the
de
supervisor
dispensation
does
qu'on
not
n'a pas
get back
abordée,
what has been
mais
lost by
ce
the
n'est pas très visible.
CHW. And
On fait juste les
the
évaluations comme
other part
d'habitude.
is not very visible, but these
Et
are
on
just
vient
the
constater ici
evaluations,
les
just
changements de
as usual.
quantité.
And then we just come
C'est
to the
calculé en
stock
background,
here
en
to the
fait.
contacts, and we can see
Voilà.
the change of
Merci
the
beaucoup. Je vous repasse le
quantity of
micro.
this unit. So this is basically what I wanted to do as a demo. Thank you very much. I give you the floor back.